Today is a very critical day. I'm glad that we are going to discuss women's leadership, particularly in the healthcare. A bit of a background on why this. So as all of us understand that the complex health structure goals require greater and more diverse leadership talent across the sector in countries. Yet the women are untapped talent pool representing only 70% of the health workforce, out of which only 25% at the executive level and 5% at the CEO level. This session aims to understand the challenges facing mid-career women professionals working in the health sector, particularly as they move into leadership roles. In this context, the session will discuss WomenLift Health India Leadership Journey Program. The WomenLift Health Leadership Journey Program is a 12-month learning experience that focuses on providing mid to senior career women working in health the tools, along with the support of peer, mentor, and coaches to successfully grow and amplify their leadership voice, expertise, and presence for impact. The program envisions providing a safe space for women professionals through vulnerability and reflection to hone their leadership skills. We are very honored to have Dr. Shagun Sabarwal with us today. Hi, Shagun.
Hi, Satyam. Hi, everyone.
Thank you for joining us today, Shagun. So for everyone, I would like to just give a background of Shagun, who is our speaker today. Dr. Shagun Agarwal is a South Asia Regional and Global Monitoring, Learning and Evaluation Director at WomenLift Health, an initiative committed to empowering and elevating talented women leaders in global health through a range of actions at the individual, institutional, and societal levels. Over the years, Shagun has been working to improve gender equality in public health in India and South Asia by promoting the use of evidence in policy decision-making, advising governments to scale evidence-based programs, and conducting impact evaluation. She has supported state governments as a knowledge and learning partner and is currently advising the government of Bihar, Punjab, Odisha to reduce ultra-poverty and improve regressive gender attitudes and behavior amongst adolescents. Prior to her role at WomenLift Health, Shagun was the Director of Policy Training and Communication at JPAL South Asia, playing a direct advisory role for the organization's health, agriculture, climate action, and gender sectors, and providing technical and strategic direction to JPAL South Asia partnership with state and central governments. Shagun has also served as a Director Clear South Asia, as an evaluation specialist with 3IE, and as a postdoctoral fellow at Population Council. Shagun holds a doctorate in public health from the Harvard University. Welcome on board, Shagun. Super excited to have this conversation with you today.
Thank you so much, Satyam, and it's a real pleasure for me to be here, and a big thank you to Arthan for organizing this fireside chat. And I'm also very pleased to see a lot of you who have joined, and I'm looking forward to interacting with all of you today during this chat.
So Shagun, I'll just jump into it. So I think to start out with, WomenLift Health has launched a program called India Leadership Journey. If you can tell us more about it. And what also inspired your organization to launch this program, or any other things that sets this program apart in the leadership journey?
Yeah, thank you so much, Satyam. So I would start by saying that, WomenLift Health, Satyam gave a quick introduction. It is an organization we started about 3 years ago. We were incubated at Stanford University in the US, and we launched our center in India last year in October. So we launched our India regional office, and we plan to also expand to other South Asian countries over the next 2 to 3 years. So WomenLift Health is really focusing on solving a particular problem, which again, Satyam had mentioned, which is really to say that when it comes to the overall field of health, we do have a lot of women as a part of the workforce. And yet when we start to look at the leadership positions where the decisions are being taken, whether it is about health policy, whether it's about health financing, health research, health services, then we find that the dominance is still, most of the leaders are men who are taking these decisions that then impact the lives of millions of people, right? So the question then becomes that when, if you have a triangle like that, when your base is there, which is full of women, you also have women throughout, why are these women not being able to reach at the top? So WomenLift Health, like you said, works at many different levels. We work with individual women leaders. We also work with institutions, which are health organizations. And again, these could be private sector, these could be government. And we defined health, again, very broadly. It includes nutrition, sanitation. It includes, anything that you can think of which is associated with health. And then we also believe that working at the societal level is very important. Now, in the individual level work that we do, we have a flagship signature program, which is the leadership journey, which I'm very, pleased to talk about, because we launched our leadership journey for next year, 2023, last month, and we are still accepting applications. So the leadership journey, Satyam, to your question, it's a highly targeted program, which is focusing on mid-career women who are working in the field of health. And again, like I said, health is very broadly defined for us. And when I say mid-career, it means these are women who have, who have been working for, say, 10 to 20 years, already. So the reason why we are doing this program and what are the core elements of this program? So the building blocks of this program are that it is basically trying to do two things. Number one, it is exposing these women leaders, and we call them women leaders because they are already leaders in whatever they are doing, to tools and frameworks that allow you to go from, middle level to the very senior level. So what we realize is that, your technical skills, your knowledge, your performance, it helps you grow to a certain stage. The moment you go to that stage and then you have to move to the senior leadership, the landscape starts to shift and the kind of tools that you need start to become very different. In our experience, it is not so much about horizontal development that you need to learn communication skills, you need to learn social media XYZ, whereas we feel that it's this stage, what is most important is to have a self-awareness, a kind of reflection that can allow you to really leverage your own superpower in ways that can, that can spotlight yourself, where you are able to navigate complex challenges that you will face, whether it's about relationships, whether it's about influencing others, whether it's about motivating and inspiring your teams. So the leadership journey is essentially trying to build this. It's a journey in which women go through an entire year where they start to hone in on this mindset shift. They start to increase their emotional intelligence. They start to have self-awareness. And the second thing that this journey is trying to do is to build networks and bonds and create these spaces where women can really come together, be vulnerable with each other, learn from each other. And again, we know that women learn differently. Women really learn from experiences of each other, and creating this safe and brave space becomes very, very important. So what we have done, this is the second year of our journey. We launched our inaugural journey in 2022, and we have had 3 rounds of this journey in the US. And what we found that the women leaders were like, we don't have this space. In a workspace, you obviously have to be guarded. You don't have a place, you don't have individuals where you can just go and say, I want to learn this, or I'm not sure about this. I'm having this insecurity. I'm having this conflict. So it's very important. So we are creating that space, those bonds. And finally, as a wrapper, once these women are as a part of this journey, they also get access to mentors. Mentors are senior women who have been working in the space of health. They're extremely established leaders. And we also give them executive coaching. So it is sort of an overall journey. And then these women become a part of the WomenLift Health alumni, where they continue to collaborate, meet, and network with women in other countries also who are a part of the WomenLift Health cohorts. So I'll stop there and see if you had any follow-up questions.
No, this is very, very incredible. I particularly like the fact that, when you are talking about the shared spaces and the support network that is provided in the program, because end of the day, everyone knows that the journey at the top is lonely, and it gets way more like, isolated, especially when you have to take critical decisions in your life. And obviously, we know what is happening in the world. The world looks at the leaders very differently. So completely hear you on that front. I also wanted to understand, Shagun, the principles of diversity, equity, inclusion, which are very, very key to the leadership journey. How important is it to inculcate diverse lived experiences into policy and practice? And how do you think the leaders can ensure these principles are taken into account while framing public health policy?
Absolutely. I think, Satyam, you've sort of hit the nail on the head with this question, because I think with WomenLift Health, our overall theory of change is very clearly saying that when you have diversity and inclusivity in your decision-making process, then the decisions that will come or emerge will be far better than if the decisions are being made by very similar like-minded people. And this is not news. I mean, we know research has established that the moment you have different people who have different ways of looking at things, it is a painful process to bring everyone together. But once you do this, what you create is far better than if we were a room of people who have had very similar lived experiences. We come from very similar backgrounds, very similar colleges. Then our decisions will not be innovative enough. They will not be out of the box enough, right? So, and with what the world has gone through over these 2 to 3 years, where it has just shaken us, and the kind of suffering that has happened, especially in the low and middle income countries, in fact, world over, there is a dire need of making sure that we are not leaving groups behind. We are not leaving the vulnerable people behind over and over again, because when the crisis hits, the loss that they suffer is just massive. And this is especially true when it comes to health. We all saw that our health systems were completely shaken. They just could not cater to the kind of need that was there. So now what does this all translate to? So what this means is that the world needs leaders for any kind of crisis that we are going to be facing in future, not only just crisis, but even opportunities, whether it's climate change, whether it's the pandemic type of a scenario that may come up, whether it is, huge job crunch, whether it's growing youth unemployment, you name it. Leadership is going to play a critical role, right? But in many ways, when we think of leadership, the kind of impression or the image that comes to mind is of leaders who are decisive, who are very quick to take actions, who are very top down, who are, who just know, okay, this is what we need to do, let's go ahead and do it. You never associate leadership with empathy, leadership which is collaborative, which is about bringing everyone together, leadership which is also, maybe an introverted person can also be a great leader, right? But so we need to kind of start reimagining leadership. We need to make it inclusive and diverse. We need to ask ourselves who's on the table when we are making important policy or design decisions. And here we feel that, we think of training as a solution for everything, right? So you have trainings for anything you say, but then why not for diversity, equity, inclusion? Why not start orienting people that, look, it's important to have equality. It is important to have equity. And to get equality, what needs to happen? The power structures have to change. So someone needs to give up the space. You can't say, okay, let's all be included and not give your space, right? So I think it's very important. And so what we do in leadership journey is that these women leaders go through this journey where they themselves start to ask questions about the power structures that are existing around them, the questions around power and privilege, and how can we bring that lens in our thinking. So I do think that by sowing the seeds of these thoughts, or by including this kind of a lens in our journey, we are already seeing that women are starting to take that approach when they go back or even as they're working in their organization. So many women of our cohort are becoming change agents in their organization. They are going back and demanding for a relook at the gender policy within the organization. Some of them are going back and saying, you know what, I work with these ANMs in rural villages. Can I start doing some kind of a leadership training for these women who also face a lot of burden in their house, who come from norms where they face domestic violence or they face a lot of, so how can these tools also help them? So it's just that, and it's not like we are these are just coming from their own self. These women are themselves saying, you know what, we need to do this. So like, that's the beauty of the journey. Yeah.
Super happy to hear this, Shagun, that these women are also going back and asking for tangible action in their respective organization. And like you rightly said, there are very few people who understand that gender policies need to exist. I mean, it's not a mandate yet, but something that goes beyond posh in a country, in a country like India, which is not, I mean, I guess the world has to be educated on that front. A lot of things, Shagun, you are talking about here also is at the core of collaboration. So it seems like what we are trying to achieve can only happen if the collaboration happens in the sector. So how does your program incorporate like collaboration amongst women leaders in the global health space?
Again, Satyam, I think that's such a great question. And I think we all here understand and know that You can't bring about lasting change, transformation by doing it alone. Whether it's an organization, partnership is going to be the essence, and especially the world that we are seeing now, it is becoming even more important, right? With the technology bringing, shrinking the world in ways, even the way the future of jobs is going, it is very, very important that we learn how to work together and how to collaborate. And collaborate doesn't mean that it is one organization's agenda or one person's agenda that and everyone has to kind of revolve around it. True collaboration means that everyone is winning. Everyone has something that is speaking to their wish list. So I think that collaboration again is extremely important, and that also is a way of leadership style, right? Like, are we emphasizing collaborative leadership styles enough when we think of leadership, right? When we think of leadership, again, I said, I think somewhere if we go back to the history of leadership, a lot of that perception around leadership is based on the World War scenario. Who were the leaders in the World War? But we are not in that situation. So we need a completely different way of looking at leadership, and collaboration is the key. Now, in collaboration also, like, for example, in our journey, we have this, in the first phase, we make women go through this exercise and this self-assessment around influence style. Like, what is your influence style? Because in being able to collaborate, you also have to bring people along. You have to influence them, right? And when you are trying to influence them, are you only trying to listen, talk to them about your agenda? Are you just pitching? Am I just coming and saying, what, this is what we believe, and come agree with me? Or you're also trying to listen. What do they have to say? So by having such kinds of tools and frameworks, again, we are sowing the seeds of how can collaboration really happen? How can we start using some of these things from our tool box to bring everyone on the same page and build that collaborative ecosystem? And collaboration among women leaders, I definitely think that is another clear pathway. So what we are seeing happening in the self-help groups, it's about women collectives. It's about women who are coming together, who have a shared goal, who are taking collective action. And now we are trying to replicate the same vision at a leadership level. And leadership, again, is at all the levels. Leadership doesn't only mean being a head of a big organization. You have excellent women leaders who are handling huge amounts of portfolios, even in rural India, even, who are the heads of village organizations, head of cluster level federations. So I think it is very important that this idea of a collaborative leadership style kind of starts to trickle down at all different levels.
Completely makes sense. Your program also talks about, like you also touched upon this while you're talking about it, different leadership styles, which are like authentic, inclusive, strategic, and impactful. So how did these styles originate, and how will the program cultivate competencies to strengthen these styles? If you can give your personal example.
So basically, that's a great question, Satyam. Again, I think that the way we have designed the journey, there's a definite arc to our journey, which
Right.
means that it happens in these different phases. And I'm also happy to give you examples as I go along. So the first important leadership style, that we think is the starting point. And without having this, you cannot really think about doing anything else, which is the style of authentic leadership. Now, what do we mean by authentic leadership? So what authentic leadership essentially means is that you are really true to what your value system is, what your inner purpose is, and that is what you're bringing your true self to the work that you're doing, to the leadership that you are trying to create. And this is especially true for women, because in a very gendered, an environment which is quite skewed, we have also incorporated or learned that there is a way of being, and a lot of time that way of being is by imitating our male colleagues or other male leaders. So like what I was saying, that the image of leadership is many times the people say, what do you think women leaders are better than men leaders? So first of all, it's not a zero-sum game. We are not saying that women leaders are better than men leaders. We feel that both are very, very important. But for women especially, they need to think back and say, okay, what is it that truly matters to me? What is my value system? Because if there's a dissonance between what you truly believe and value and what you're doing, you can never be really truly successful in your leadership. So you need to bring this together. So we start with a leadership journey. The first quarter is about bringing that authenticity. And why are people not authentic? People are not authentic because there is a fear. So you have to face your fear, because it is like, if I want to be my true self, will there be rejection? Will I not be successful? There's always a fear at the heart of it. So you have to start confronting that. Now, this all may seem very esoteric, but the way we go about doing this is that the first quarter, they really do a lot of self-assessments that helps them understand more about themselves. What is their leadership style? What are they currently, what can they add more to their styles, right? And we do this through coach support. So the women really go into this journey, which is a journey of their own self. And then it helps them enhance their insight, energy, and resilience. So you can only start to impact others when you first know who you are and what your authentic leadership style is, and you are being comfortable with that, right? So that's the first part of the journey. After that, leadership is all about others. It is about influencing others. It is about bringing others together, whether it's your team that you're trying to motivate or it is your partners that you're trying to work with. And like I said, the challenges and the landscape is becoming more and more complex. What we are doing today, the landscape in which we are working, in which we are making our teams work, is so different from what it was a few years ago, so different from what it was during the pandemic, right? And then you have things like the pandemic, which shakes the whole thing. So how can leaders kind of try and still be the leaders that are really supporting and helping everyone? So this is where inclusive leadership becomes very important. And in the second quarter, we really make women go through these exercises. They go through a lot of group work, which is really focusing on inclusive leadership. And then the third is a strategic leadership, which basically means that now you understand, you know how to relate with others, you know how you can influence you. It is also about your leadership presence. It is about the art of storytelling. So we then make them go through this entire phase. And the final phase is about the impact. So whatever you are doing, what impact is it having? And that again is about capturing or harnessing the collective energy, right? The leader is not doing every task on his or her own self. You're making others come together and do something. So how do you harness that collective energy is what the last module focuses on. So I'll stop sharing, but that was just a quick background of the styles.
This is quite incredible, and which brings me to my next question, which is, which one do you relate to the most, Shagun? Your own personal journey.
I think, of course, all of these elements are extremely important, but I am just realizing that so much of what is happening in these leadership journeys is also speaking to my own journey. And I am also feeling, I come from a space, my training has been in the space of, data, research, evidence to policy. It is a lot about, sort of the hard quantitative aspects of saying, okay, whether we are making an impact or not. While, of course, at the same time, I've had a lot of experience in doing field work and meeting with the people that you're trying to serve. Ultimately, there, in the development space, in the health space, you really want to have that as the central theme of your work, that, and making sure that their voices are also being heard. But I feel that, I really feel that there is a big difference from the middle level to going all the way to the senior level. And there are a lot of demons that, all of us face. Demons of self-doubt, demons of imposter syndrome, demons that tell us, you will not be able to succeed. There are insecurities that come. But it is very important that if you have a purpose, if you know what you are doing is something you really enjoy, and you feel heard, seen, and valued by your team, by your organization, then you can really be very effective and you can quieten down those demons. So I am at a stage where I feel like I have found my inner sort of journey where I feel this is the work that I'm doing is great and there's so much to do in this space. And not everyone has that privilege. I do agree that some of us have our constraints where we just can't go out and do what we love doing. But even knowing what I want to do and slowly and surely starting to move in that direction is very important. Because if you don't have that awareness, that is what I've learned from my own sort of personal journey so much. So yeah, I think I am trying to work on all these different styles right now.
No, very super happy to hear that. I mean, Shagun, you have personally worked a lot in the gender and the health space.
Yeah.
And what are some ways you will ensure gender equality, especially in these sectors of leadership? If you want to shed some light on that.
No, I think, I have always been very drawn to this problem. Even when I was doing my PhD, I remember my thesis topic was looking at, sun preference using this big, data set that the government has and trying to see, what is the impact of sun preference on, health, etc. And throughout, I have tried to really do my best. But what I realize is that when it comes to a country like India, our gender inequality is starting to be something which no one can understand. Like the paradox is so huge, right? Whether you look at women's labor force participation, whether you look at any other indicators, health, etc., we're always at the bottom when it comes to gender equality, right? Despite having had so much economic progress, despite there being so much talent, education, everything is there. So I think on the one hand, I really feel that there are a lot of investments that are happening right now, whether it's from the government policy side, whether it is from the civil society organizations, donors, and we are all really trying to work at many different levels, whether it is mitigating the barriers that women and girls face so that they have access to opportunities like education, better health, better rights, or it is doing work around norm change. I think there is a lot that is happening. But I do feel that the part that we are still missing is the leadership part, right? And that is kind of you're missing. And again, like I said, leadership, even like who's talking to the women leaders who have fought their way up in when, the circumstances were completely against them and won that? Who is helping them, supporting them? Who is their coach? Who is their mentor? Right? And I feel like those are the things that we need to start really thinking about, because the challenges that we are going to confront, as a country, as a sector, they're going to be really kind of very unpredictable, nothing that has happened before. So I think it's very important that we start to invest in leadership, and gender equality shouldn't only be about the grassroots. I think gender equality also has to shift at all levels. So that lens is very important.
That's a very critical point. I think a lot of time when you talk about gender in a universal sense, people always try to link it back to the grassroots and
Yes.
especially in the space we are in.
Yeah.
And that transformation, sometimes it's important to at the top too, because it can't just be a bottom approach. It has to be a universal approach.
Absolutely. Very well put.
And what advice would you give to mid-career professionals working in the health sector with the aim to climb the ladder and become a senior leader long term, especially in India?
Yeah, I think the way I would say is that, there are a lot of challenges. There are a lot of, the space is not easy navigating your work life situation, navigating the workplace politics. There's still a lot of kind of predominance of men leadership. I was talking to someone the other day and they were saying the worst sector is actually the non-profit health sector. If you look at the non-profit health sector in India, you will find it's only men at the top. Whereas, there are women, but they're all in very junior positions. And so I think it is not easy. But one advice I would give to women is that one, do try to, push yourself to build networks, and networks again is looked down upon. People feel networking is this very, cheap thing. It's a very artificial thing. But for us, networking is relationship building, and women build relationships very differently, right? Someone was saying even networking is a very male model of networking, but we need to find our own ways, So do try and go out of your way to create this kind of a setup where you can say, okay, this is my support group. It doesn't have to be within work. Also, it could be outside, go see wherever there are opportunities to meet other people, think about what they're saying, how you can open your mind. You don't again have to find people who are exactly like you or so like-minded. That's one advice, because these support groups can really help. Second, I do feel that somewhere it's also important for us to continue this journey of self-learning. Like some of the things that we focus on our journey are not very tangible things, that do this course on time management or do this course, but there is a lot of material out there. So like there's this person called Brené Brown. If you go onto her website, she's really talked about Dare to Lead. And so there is a lot of these themes, which I listen to a lot of podcasts, and they are very, if you don't have the resources to have a coach or have someone more formal, I think some of this can really help. So this is my advice, that do try and get there. Yeah.
I completely agree with you, Shagun. And I guess you're also right about the way things like network and networking is perceived. I guess sometimes we have to drop the ing networking and just stick to the network.
Yeah.
And that has a more positive connotation in terms of which group do you belong to, which community do you know or have,
Yeah.
and who people in your sort of first degree who you can reach out to when you need help, or
Exactly.
any kind of like support structures.
Yeah.
There are ways of creating these, sort of like communities. And the more you create it for yourself, the better it gets in the future. Great. With that, we'll take some questions. I will take the first question we have from Arundhati. So Arundhati is saying, Shagun, women leaders face conflict between their professional lives and career growth and their personal lives and roles. How do you address that in your program? Also, women leaders have an opportunity to support future female leaders. What are your thoughts on this? How do you do this when you are navigating your own personal growth? Two questions.
Great questions, fantastic questions, Arundhati. I'm so pleased that you brought, and I had in fact missed talking about them. So I think I completely agree. I think when we did this study of mid-career women leaders, one of the top constraints that came out in India was this problem of work-life balance, and how women had to give up one or the other. And there are a lot of women who have famously said, like Indra Nooyi said, you can't have it all. We do think that it is possible to get, and of course you need the support of your family, you need the support, and that is why at our journey we also have sessions which focus on work-life harmony. We call it harmony because balance is probably not the right word. And also our work at the institution level and at the societal level is trying to speak to what can organizations do to make it more conducive for women leaders to grow and for there to be more harmony between their home responsibilities and work. So we never think that the onus is just on the women, that she will, she has to be a good leader. But having said that, our program does focus a lot on achieving this work-life harmony of putting yourself first. It gives you tools and strategies to be able to do that. And some of that has actually been a big hit with the women cohort, some of the practical tools that we have provided to them. But ultimately, I agree that women cannot go very high if they don't have the right support in their home. And that is something that obviously we don't have control over, but we can tell you how to manage and balance these priorities. So that's definitely a part of our curriculum. Second, I think what you have asked about this idea of future females opportunity, that is really another core of our work, is paying it forward. So while our program is going to help these women hopefully become, go up the ladder, it's not just about them. The message that we are giving is that how are you also then becoming better mentors tomorrow? How are you making sure that you are playing that role in being the better leaders, in getting the women to come in the front, getting because we also feel intersectionality is very important. It's not just about gender. It is about class, caste, other kind of, sort of identities that don't get opportunities because of existing power structures. So I definitely think that's another very important theme. And we've already started to see women becoming really passionate about this idea of what can they do to keep this field building forward. So I hope that answers your question.
Thank you so much, Shagun. The next question is from Shailja, asking what type of work is done under the program in year 1, along with the professional work. So am I getting it correct? Yeah.
Yes. Again, great question. So one of the elements that we have in our leadership journey is a leadership project. So every woman has to choose a particular project that she's very passionate about, that makes her heart sing. Now, this project doesn't have to be big. It doesn't have to be small. It is something that you feel passionate about. And that's why it's also a way in which you can showcase your leadership, right? So for example, there's a person in our cohort who's a scientist, but she's very passionate about doing some work with, say, adolescent girls. So she's doing something very small. She's just going into this, a particular slum area near her house. She's going to do some interviews there. What do these women think about women leaders? She's going to compare that. So it could be any project. It could also be a project that you're doing as a part of your organization, but there's a stretch goal. There is something where you say, okay, it's my passion, so I am doing that extra lift. So that is the only requirement that we have, which is a leadership project. And other than that, it is, of course, your commitment. So we have also designed this program keeping in mind that these women are extremely busy. They are already at mid-career. They have so much work, plus they have their families. So how can we make sure that they, so we are not having too many sessions. We have designed the touch points in a way that they're able to keep up. So that's the other requirement that we do. We have anyway fewer sessions, so we want you to be present. So those are the only two big requirements from our side.
Thank you, Shagun. And just for, if you can, you said that the applications are on. Can you just tell us about when the application process will end and when the program begins, just like so everyone is aware.
Absolutely. So we will be ending our application process on December 9th. and all of the information is on our website. We have a separate brochure, and anytime you have any other questions, please reach out to me. After this applications, there's a selection committee that will go through all of the applications, and we will select 30 applications. So our cohort size is restricted to 30. And then we are going to launch the program around May. So April is when we'll have the orientation, and the program will be launched in May. It is a blended program. So we bring together these women in the beginning. So around June is when you come together, and then you commit at the end during the culmination, which is called the lift off. So that happens in that will happen in March of 2024. And all of the other details around, like, what we do is that we will give you, like, you will have it all calendarized. So your calendar will tell, even a 12-month calendar will be there, when are the touch points which are mandatory, so that, you can kind of make your calendar accordingly. So this is the overall structure. Yeah.
Great. No, thank you so much, Shagun. This is a pleasure learning about the program, learning about your journey. It seems like an incredible opportunity for women leaders in the sector to apply for this program. I wish that things like this were there even 10 years ago, but it's never late. You should have been there right from the beginning. But so congratulations to you and the entire group for thinking of this very, very impactful and a need of the hour to bring more women leaders in the healthcare space.
Yeah.
So thank you, Shagun.
And thanks a lot to Arthan for helping organize this.
Thank you, Shagun.